Number 6. Biologics in orthopedic repair.
One twist, a pop, and the dreaded ACL tear means months or even years of recovery. Anywhere between 5 and 40% of patients may never return to their sports or daily activities. And for those who do, there is a 20% chance of re-tearing the anterior cruciate ligament. There is hope for better long-term results using the patient's own tissue and immune system with biologics in orthopedic repair. These cells, blood components, growth factors, and other natural substances replace or harness the body's own power to promote healing and decrease inflammation. The new technique uses a sponge injected with proprietary biologic factors in combination with the patient's own blood to stimulate healing of the ACL, preserving tissue rather than cutting it. A trial using this procedure is ongoing. Other potential uses for biologics in the orthopedic arena include its use in rotator cuff repair and as a coating for implant devices to reduce the risk of infection. Biologics hold the potential to provide every orthopedic patient a more natural, more effective, speedy recovery.